Hi, we're Team 3, and we plan on preventing scar tissue growth with an implantable hydrogel. I'm Allie Gannon, and I'm presenting with Angie Farrow, Lydia Massey, and Taylor Paradis.
Scars form in 100 million patients annually from surgeries performed in developed countries alone. The incidence of hypertrophic scarring, which is a thicker and more raised tip of scar, following these surgeries is 39 to 68%. The formation of scar tissue is a natural part of the healing process in wounds, but a buildup of this tissue can cause further damage to the body, such as pain, stiffness, chronic inflammation, and lead to limited mobility. The scar tissue on the left is chronically inflamed and formed around an implanted biomaterial. Cases like this can necessitate a revision surgery. The knee on the bottom right has a buildup of collagen from scar tissue, causing arthropobrosis and pain in the joints. Besides making more strategic incisions, current technology focuses more on reduction after scar tissue has already formed, putting patients at risk. Our lab has the technology to limit the growth of scar tissue and prevent this issue.
Our approach is to create a way to allow electrical stimulation to be delivered to an area of expected scar tissue growth without permanent implantation. We also wanted to stop the formation of scar tissue at the source by limiting inflammation and preventing angiogenesis. We will work to create an electroconductive hydrogel by using a conductive, choline-based bioionic liquid called BioIL. The polymer we will be utilizing is PEGDA and a 20 to 80 ratio of polymer to BioIL. This will create a hydrogel that is conductive, biodegradable, and non-cytotoxic with a minimal inflammatory response. To prevent inflammation and angiogenesis, eosinic acid and TSG6 will be mixed into the gel. And if the surgery is likely to result in the formation of scar tissue, the gel will be placed under the skin before the patient is closed up. This, coupled with an external electrical stimulation device, will allow current stimulation to be delivered deeper into the tissue than typical and non-invasive stim. The gel will act as an amplifier to the electrical stimulation, promoting healing deeper into the affected tissue. Meanwhile, the UA and TSG6 will be working as anti-angiogenesis therapy and limiting the deposit of collagen to stop the growth of scar tissue. So our goal is to minimize scar tissue growth by 80% by volume, meaning the exact amount will vary by patient and application. Patients will pay for this treatment as part of this surgery, as a thin layer of the gel will be spread on the entire affected area before closing.
Here we have a brief cost-benefit analysis overview. In short, our solution is valuable to the consumer in that it limits invasive surgery and prevents loss in the range of motion typically caused by scar tissue buildup. This not only speeds up the recovery process, but makes the entire experience less painful for the patient. There's also the added cosmetic value of a less visible scar. Some drawbacks to our solution is the additional cost of production and cost to the consumer during implementation. Though it is a theoretically short process, it's another step in a surgical procedure, which in itself can have adverse effects. It will also need to undergo various means of testing before it is able to reach the market, like all new devices.
These are some of the current treatment methods for helping with scar tissue. Like mentioned, scar tissue can be very painful, itchy, and reduce one's range of motion in the area. So trying to reduce these effects are very important and very beneficial to the patient. There are multiple different approaches to treating scar tissue, and I've listed 5 of them on the slide. There's pressure therapy, corticosteroid injections, laser therapy, radiation therapy, and revision surgery. Typically, everyone goes through pressure therapy as soon as possible after surgery. A notable company that specializes in it being ASTEM. But if the pain or range of motion is still a problem after the pressure therapy, then typically corticosteroid injections are used as a treatment method. And even if problems still continue to persist weeks or months later, then laser therapy, like Springboard's physical therapy cold laser, which uses light energy at various wavelengths to increase cellular metabolism, radiation therapy, or revision surgery can be an option. The reason there's so many current treatments for scar tissue is because none of these options are 100% effective, and most of them have a pretty large chance for reoccurrence of the scar tissue pain and limited range of motion problems. Our solution will allow for the limitation of scar tissue growth in the first place, instead of waiting for it to form and then treating it.
Our audience is surgeons, patients, and insurance companies. Surgeons would be interested in an innovative device that will improve patient outcomes and prevent the need for risky revision surgeries to remove scar tissue. Patients will also benefit from only needing a single surgery, as 1% of all general U.S. surgeries are to account for scar tissue adhesions alone. This percentage accounts for $2 billion annually, the elimination of which would help appeal greatly to insurance companies who pay for these surgeries.
Thank you, and here are our resources for this presentation.